Hi everybody, welcome to my channel, New Some. Thank you for coming by and listening to my content. Recently we're, seeing in the past week or so that the hotspots such as in New York, New Jersey, Chicago, and New Orleans are topping the list of the most cases and deaths. And now Detroit is also the center of coronavirus outbreak that has hit overall hard across the whole country. It has been estimated this week that Detroit will mark its uttermost of new cases. And what is causing all these cases to rise at such maximum levels is the poverty and lower income people. And unfortunately, the virus is spreading fast and throughout poor neighborhoods and populations with poor health outcomes. Many of us, would believe that how can Detroit be such a hot spot in this virus, because it doesn't have as heavily crowded population density as compared to other major US cities, and residents are mostly relying on cars to get around as public transportation services are limited. But the spread is still rising. Health experts say that car manufacturing has played a major role of Detroit being a hotspot city. Detroit's Metropolitan Airport, usually called Detroit Metro Airport, which is one of the busiest international airports, connects the auto industry to other global car manufacturing hubs, such as in Italy and China, which, not to mention, both led into virus hotspots. Detroit's car makers have factories in both countries, and now that they lead the virus, and that may have led the virus to arrive early here in Detroit. Now, many manufacturing workers, they cannot afford to take a sick leave, and that makes it even harder for them to work from home. Now, the similarity between New York and Detroit and other low-income areas is unfortunately poverty. Poverty causes poor health conditions, lack of access to healthcare and other basic needs, and social distancing guidelines are harder to take place. And data actually shows that these highly densely populated areas by far have the most cases of virus, and it's affecting nearby cities and counties as well. According to Dr. Abdul El Sayed, who is the city's former health director, he said that the severity of the virus is determined by the people who become infected and their environment. According to state figures as of yesterday, which was Monday, Michigan had recorded over 17,000 positive cases of the virus and 727 deaths, with nearly 90% of the deaths happening in the Detroit metro area. Denise Fair, who is the city's chief public health officer, she said that I can tell you without a doubt it's going to get worse before it actually gets better. And in order to make more space for COVID-19 patients, the city is also converting their convention center, which is called TCF Center, where the major Detroit auto shows take place. And they have converted that into a 1,000 bed field hospital. Doctors and public health officials are worried, as many people in the city do not have health insurance and access to health care, and the extensive of critical health conditions such as diabetes, heart problems, lung-related issues, asthma are much higher here than anywhere else in the country, and that will push the population into danger getting sick from the virus. As of now, the city will start soon using the new 15-minute test results. It's also contributing in a treatment experiment to use an anti-malarial drug in order to prevent infections among first responders. Thank you.